I'm Dr. Will Jordan. I was the principal investigator for the Gore CTAG 0803 study, so the clinical trial to evaluate the new conformable endograft to treat thoracic aneurysms. The study design was a prospective multi-center trial that was all patients who had aneurysms. We proved that it was a durable device. It worked well in some patients with very complex anatomy. It was easier to get through some difficult anatomy and move through these tortuous arteries. The key outcomes included the ability to get the graft in place and to get the patient through the procedure. So the most compelling outcomes, particularly at my stage in professional career, is durability, that they went 5 years and beyond. So when you're first treating some of these difficult patients and you really just want to make sure they can get through the operation and get to the next day, but then when you start to follow patients over the long term and you see them for their annual surveillance, it's just very reassuring to know that you can walk back in and tell them, this graft looks great, go away, I'll see you in another 1 to 2 years. I think most importantly that the PTFE material holds up and there's no late failure that we found. And so I think that goes a long way to know that this is going to be a graft that will stay in place. You don't have to worry about a endotension leak or something that might be going through the graft. And so it's maintained its durability through that. One thing that is important is it is a conformable device. I think it has some compliance in it enough so it doesn't create too much stiffness in the native aorta. Seeing the durability of the device is very important. So the clinical outcomes that I think were important is the fact that these patients who had thoracic aortic aneurysms could get through an operation at a rather good rate and have a relatively low mortality. These are ill patients, and the fact that we can essentially repair a major problem with a minimally invasive approach is great. And so this just showed that that continues to work. So the all-cause mortality in the study was clearly higher than aneurysm-related mortality. Again, these are elderly patients, so that's sort of expected, and there are other comorbid diseases. The two late mortalities were both related to reinterventions that were needed for continued aortic disease, and both were really related to iliac access, and that shows that it's not always easy. You still have to be careful because these patients can be challenging, and you need continued attention towards how you treat them. There's real professional satisfaction for me and for patients when we can deliver new devices to them and they go into those studies with a little hesitation, a little uncertainty, and then to go to them 5, 6, 10 years later and say, hey, that was the right decision. We thought carefully about it. There was an unknown part to it, and you still had a great result. A weekend I was walking through someone's neighborhood gym, one of these gyms, and an aneurysm patient was in there lifting weights, 75 years old, lifting weights. And I asked him to pause and I said, can I get a video of this? Because to me that just shows that they're living life, and that's what we're trying to do, give them life. Knowing about 5-year results just fits into the treatment algorithm for a vascular patient.